Adding group sessions won't make your practice an IOP or PHP in Michigan. All SUD programs in Michigan require state licensing, and your clinician's individual licenses don't answer that question. Here's how to pressure test whether a Michigan IOP or PHP expansion is realistic before licensing, payer, or documentation assumptions become expensive. We'll cover 4 readiness areas: licensing, staffing, your location, and payer billing. Your practice may already have licensed social workers, counselors, psychologists, and prescribers. Those individual professional licenses do not answer whether the business is operating a state-licensed SUD services program. In Michigan, SUD program licensure starts with LARA's Bureau of Community and Health Systems, not the Bureau of Professional Licensing. The risk is assuming a group practice becomes a Michigan treatment center by adding more group sessions to the calendar. Advertise IOP or PHP before resolving licensure, and assumptions can harden into launch blockers. That puts build-out, hiring, marketing spend, and payer contracting on the line. A generic group practice software setup often breaks when the business starts operating like a treatment center. Behave Health's EHR, CRM, and RCM are designed to support program admissions, group schedules, and authorizations, plus treatment plan reviews, progress notes, discharge workflows and reporting, structured addiction treatment workflows, not generic practice administration. Before you market the program, resolve 4 readiness areas. Let's walk through them. Area 1, licensing. Verify Michigan SUD program licensing through LARA BCHS Substance Use Disorder Licensure. State licensing is required for all SUD programs. BCHS points providers to application materials, licensing fees, administrative rules, and related legal resources. The conversion question: does your population, marketing language, clinical intensity, and service category cross into a regulated SUD program? Area 2, staffing and clinical leadership. Most group practices are built around clinician availability and individual caseloads. A Michigan SUD IOP or PHP needs program-level leadership. That work includes level of care decisions, group programming, treatment planning, utilization review, discharge planning, credential tracking, and quality oversight. Define the operating model: population, hours of care, payer mix. Then validate staffing against LARA BCHS expectations. Area 3, your location. Can the office support confidential group programming, IMTING, family work, and discharge planning without privacy or workflow problems? Check the lease, local use, accessibility, emergency planning, and physical layout against the proposed service category. A change in location, ownership, program name, director, or service categories may require additional LARA BCHS review. Area 4, payers and billing. Billing ordinary outpatient therapy does not mean you can bill SUD IOP or PHP. Verify enrollment and authorization with MDHHS, CHAMPS, your PIHP, and commercial payers like BCBSM. Frame the review with Behave Health's guides to IOP billing codes like H0015, H2036, S0201, and S9480. This is a readiness diagnostic, not legal advice. Before launch, verify the current Michigan path. Confirm licensure and enrollment with LARA BCHS, MDHHS, and CHAMPS. Pressure test PIHP relationships, target payer contracts and documentation with qualified counsel and your implementation team. Stop letting licensing and payer assumptions harden into launch blockers. Talk with Behave Health to scope your Michigan conversion at behavehealth.com. See an EHR, CRM, and RCM designed for structured addiction treatment workflows. Book a 20-minute demo at behavehealth.com.